Okay, so welcome back to this next video in which we are discussing Alzheimer's disease and Alzheimer's disease medications. Okay, right, so we're currently in the process of discussing the large-scale picture of what happens in Alzheimer's disease. We've discussed that Alzheimer's disease is a neurodegenerative disease in which neurons are going to be dying. Okay, now, we've seen the histological features of neural tissue which is suffering from Alzheimer's disease, and before going on to the actual biochemistry of what causes those histological features, what we're going to discuss is which portions of the brain are affected worst, okay? And these are the portions of the brain that are going to go first in Alzheimer's disease, okay? Their function is going to be lost first. In the later stages of Alzheimer's disease, all the portions of the brain are starting to degenerate, and that's why you get the really severe symptoms in the late phases of the disease. But in the earlier phases of the disease, only the portions that are affected worst have started to degenerate majorly so far, and therefore the initial symptoms of the earlier disease can be explained by which portions of the brain are affected worst. Okay, so we've discussed that one of the first symptoms of Alzheimer's disease is this deficit in declarative memory, and we've seen that the reason for this is that the hippocampus and the entorhinal cortex are particularly badly affected by Alzheimer's disease, and their function is going to be compromised first in this disease, which is why the first symptoms that emerge are this loss of declarative memory, which the hippocampus and the entorhinal cortex are extremely involved in. Okay, now, later on, slightly later on in the progression of Alzheimer's disease, you start getting cognitive symptoms. Now, it's believed that the early cognitive symptoms of Alzheimer's disease are not actually caused by the degeneration of the cortex. In the later stages where you've got full-on dementia, then yes, the cognitive decline is due to degeneration of the cortex. But initially, in the early stages of Alzheimer's disease, it's believed that the loss, the impairment in cognition is caused by loss of the basal forebrain cholinergic nuclei, which is the other major area of the brain that is particularly sensitive to Alzheimer's disease. Okay, so I now want to discuss these basal forebrain cholinergic nuclei. Okay, right, so I'm not going to show you all of the basal forebrain nuclei. I'm going to show you the biggest basal forebrain nuclei. There are multiple basal forebrain nuclei, but the one I'm going to specifically show you is the biggest easily, and this is the nucleus basalis of Maynard. Okay, now the nucleus basalis of Maynard, which is often abbreviated nucleus basalis of Maynard, which is often abbreviated as the NBM for nucleus, and basalis, and then Maynard is the M. Okay. Firstly, it often is just called the nucleus basalis. So if you hear people talking about the nucleus basalis, that's the same thing. Okay. Now, before I show you where this actually is, I want to talk to you about what this nucleus is actually doing. Okay, so normally in the brain, most neurons use as their neurotransmitter glutamate or GABA. Okay, glutamate is the major excitatory neurotransmitter, so if you release glutamate onto a neuron, it makes it more likely that that neuron will fire an action potential, and GABA is the main inhibitory neurotransmitter within the brain. It makes it less likely that that neuron is going to release an action potential. Okay, right. However, some neurons in the brain use the neurotransmitter acetylcholine. Okay, now acetylcholine has both ligand-gated ion channels as receptors and also G protein coupled receptors as receptors for it as well. Okay, now very few places in the brain actually use the neurotransmitter acetylcholine. Okay, and the basal forebrain nuclei are the structures in the brain, the few structures in the brain which actually contain neurons which use this neurotransmitter. Okay, so before discussing the broad function then of acetylcholine in the brain, let me just show you the structure of acetylcholine. Now this will come in useful later when we come on to discuss Alzheimer's disease medications, okay, because one of the major classes of medications for Alzheimer's disease is going to work by potentiating cholinergic neurotransmission, by blocking the breakdown of acetylcholine. Okay, so let me show you then the structure of acetylcholine. So basically it is an ester formed between acetic acid and the alcohol molecule choline. Okay, so let's start off by drawing the acetyl group then. Okay, so the acetyl group. So we're going to have the carboxylic acid group here. Okay, and now acetic acid is just a 2-carbon carboxylic acid. Okay, it's the kind of acid that you have within vinegar, and it would now be called as ethanoic acid. Okay, so here we go. Here is our acetyl group here, so I'll highlight this in orange. And now the acetyl group is going to be attached to a choline molecule to form acetylcholine. Okay, now choline is an alcohol which has been linked to the acetic acid by an ester link. So here is the oxygen of the choline's alcohol group now bound to the carbon of the carboxylic acid group of acetic acid. Okay, and now the rest of the choline molecule then, you're going to have firstly an ethylene group. Okay, so 2 methylene groups, like so. Okay, and then on the other side, what you're going to have is a nitrogen atom, and this nitrogen atom is going to have 3 methyl groups coming off it. Okay, 1, 2, and then the third one here. Okay, now that means that this nitrogen has 1 more bond than it should have. Nitrogen is only meant to have 3 bonds, remember. Okay, that's its ideal number of bonds. It's meant to have 3 bonds and then a lone pair of electrons. When nitrogen has 4 bonds, as it does here, that means that one of these bonds must consist of both the electrons from the nitrogen. Okay, so let's say it's this bond here that's the unfair bond. What has happened in this bond then, I'll just highlight it in purple, is that both of the electrons in that covalent bond have come from the nitrogen. They are effectively the lone pair that the nitrogen once had. Okay, so the normal understanding of a covalent bond is that 1 electron comes from each member. Okay, so the nitrogen is supposed to put in 1 and the carbon is supposed to put in 1, but in this bond the nitrogen has put in both electrons. Okay, now, because of this, it is as though the nitrogen has given an electron away to the carbon, because remember, the normal understanding of a covalent bond is that 1 electron belongs to the nitrogen and 1 belongs to the carbon. Okay, so it's as though the nitrogen has given an electron away to the carbon, and that gives the nitrogen here a positive charge because it's given 1 of its electrons away. Now you might say, well, does that mean this carbon's going to end up with a negative charge? The answer is no. Because when the carbon came into this sorted arrangement, it will have originally had a positive charge. Okay, so when it came in and formed this single bond with the nitrogen atom, it got that positive charge neutralized by the receiving of the electron from the nitrogen, and effectively deferred the positive charge onto the nitrogen. Okay, so choline overall has this positive charge where the nitrogen is at this end. Okay, right. So this portion here then, this is the choline molecule. Okay, so then the whole thing then is called acetylcholine. Now, as I say, acetylcholine is quite a rare neurotransmitter in the brain. Very few neurons in the brain use acetylcholine as their neurotransmitter. Okay, now the neurons which do release acetylcholine as their neurotransmitter, they are all located in a certain portion of the brain. They all have their cell bodies in special areas of the brain. Okay, so all the neurons which use this as their neurotransmitter are aggregated together into nuclei, basically. They all have their cell bodies in specific areas, and these nuclei that use acetylcholine are known as the basal forebrain nuclei, because they are at the base of the forebrain. Okay, some people will even call them the basal forebrain, and then you can insert in here the word cholinergic because they use the neurotransmitter acetylcholine. Okay, now there are multiple basal forebrain cholinergic nuclei, but as I said, I'm only going to focus on one of them. I'm only going to show you the anatomy of one of them, okay, which is this nucleus basalis of Maynard, the NBM. This is the biggest of the basal forebrain nuclei. The others are all sort of clustered around this one. Okay, right, so let's discuss the anatomy of the nucleus basalis of Maynard then. Okay, and that will help us to illustrate what the function of these cholinergic nuclei are. Okay, so we're going to go back to showing the hypothalamus from the left-hand side. So effectively, I'm going to go back to this picture here, and I'm going to look again at the hypothalamus drawn from the left-hand side. Okay, right. So here is the hypothalamus viewed from the left-hand side. Here's the optic chiasm again. Here is the pituitary stalk with the anterior and the posterior pituitary here. Then you have the mammillary body back here. Okay, so that's the hypothalamus, and we won't draw the portions behind that. Now I'm going to add on another structure onto this picture. I'm going to add on a structure that lies above the hypothalamus. Okay, now this is not yet the nucleus basalis of Maynard. Instead, this structure here is a bundle of axon fibers that moves in this sort of direction. Okay, so it's going into the page in the direction that my pen is moving. It moves over the top of the hypothalamus, and it's going to travel from one temporal lobe, the left temporal lobe here, to the right temporal lobe that's on the other side. Okay, so what is this special bundle of fibers that is above the hypothalamus here? What's known as the anterior commissure. Okay, now this is a good landmark for understanding where the nucleus basalis of Maynard is. Now before I put the nucleus basalis of Maynard onto this picture, I'm firstly going to draw this picture from the other angle so that you have a very thorough understanding of what the anterior commissure is. Okay, so if I view it from above again, okay, so here is the hypothalamus again, viewed from above, okay, and remember it just makes up the wall with the third ventricle sitting in the middle here. Okay, now the anterior commissure then is going to be this bundle of fibers moving over the top of the hypothalamus here. So this is the anterior commissure here. Okay, right. Now let me show you where the nucleus basalis of Maynard is on this picture. Now the first thing to say is that you have two nucleus basalis of Maynards. Okay, you have a left nucleus basalis of Maynard, and you also have a right nucleus basalis of Maynard. Okay, and I think I'll show them on this picture first, so let me just extend the anterior commissure a little bit. Okay, so here we go. Now, the nucleus basalis of Maynard's then are going to be underneath the anterior commissure, sitting on either side of the hypothalamus. So they're going to be under the anterior commissure on either side here. Okay, so I will just colour in the sides of them that are peeking out from underneath the anterior commissure there. Okay, because they are underneath the anterior commissure. So if I show them on this picture, they're going to be sitting, well, we're only going to be able to see the left one here, because we're looking from the left-hand side, but here it is, sitting underneath the anterior commissure there. Okay, so this then, this is the nucleus basalis of Maynard, the left nucleus basalis of Maynard, and then we've also got the right nucleus basalis of Maynard. Okay, right. Now, what then is the function of these basal forebrain nuclei? And again, I'll stress, I've shown you two here. Okay, the two nucleus basalis of Maynard's. There are other basal forebrain nuclei as well, which are in a similar location to this. Okay, so what is the function then of these cholinergic nuclei? Well, basically, they are going to send their axons out from this area. This is the area where all of the cell bodies are located, but they're going to be sending their axons all over the place, okay, to supply the cerebral cortex with acetylcholine, basically. And this acetylcholine is believed to have a broad regulatory function, basically. The nucleus basalis of Maynard is releasing acetylcholine all the time onto the cerebral cortex. Now let me just show this in another picture. Okay, a little picture that I'll put here. So if we now draw a sagittal section of the brain, so what I mean by a sagittal section is that we are going to cut the brain down the middle. Okay, so what you're going to do is put the front of your carving knife at the front of the brain, the back of your carving knife at the back of the brain. You're going to cut down, and you're going to do it right in the middle, okay, down the great longitudinal fissure that divides the two cerebral hemispheres up, okay, and that's known as a sagittal section. Okay, so we're going to take a sagittal section, okay, right, And what we will now see is the right cerebral hemisphere. So I'm going to draw you the right one. Okay, so we've opened up, split the two portions of the brain apart. Okay, so you've got the right cerebral hemisphere and the left cerebral hemisphere now separated, and we're going to look from the left-hand side, looking at the inside of the right cerebral hemisphere. Okay, so here is the front bit. Okay, and then we're going to have the right temporal lobe here. Okay, then you're going to have the right half of the brainstem, so here is the right half of the pons here. Then you'd have the right half of the medulla below there. Okay, then you'd have the midbrain here, the right half of the midbrain. Then you'd have the right thalamus sitting on top here, and then of course you're going to have the right hypothalamus here. Okay, with the right half of the optic chiasm, the right half of the pituitary stalk, the right half of the pituitary, the right mammillary body, and there we go. Okay, now I'll just finish up the back here. Okay, so finishing up the back, you get something like this, and then here is the right half of the cerebellum right at the back there. Okay, so putting then the right nucleus basalis of Maynard on, it would be behind this portion of the hypothalamus that we can see here, but I'll draw it there. Okay, there it is, sitting behind the hypothalamus. And what's going to basically happen is it's going to be sending out axons, okay, which are going to be taking this sort of a path, okay, and some of the axons will, this is a huge great bundle of loads of axons, not just one axon, okay, and off this bundle will be coming loads of different axons at different points, and they will be going to the cerebral cortex of the right cerebral hemisphere here and supplying it with acetylcholine. Okay, so they're releasing acetylcholine onto the cerebral cortex basically. And then of course the left nucleus basalis of Maynard will be doing the same thing basically. Okay, right, so what then is the broad function of this? Well, it's believed that acetylcholine dictates how functional your cognitive abilities are. So you know that sometimes your brain is working fantastically. You can calculate like that. You can solve problems like that. You can talk and understand language like that. Okay? You can visualize in 3D really easily. And then at other times your brain isn't working so well. So for instance, when you're about to go to bed, when you're really tired, your cognitive ability is not particularly great. Okay? Why? What's changed? Why is your cerebral cortex functioning less well? Well, it's believed that it is the acetylcholine transmission to the cerebral cortex that determines how functional it is, how much it's working basically. Okay, so when acetylcholine is high, okay, and you're releasing lots of acetylcholine onto the cerebral cortex, your cerebral cortex is going to be functioning fantastically well. Okay, and you're going to be able to do a huge number of cognitive tasks easily, basically. Okay, when your nucleus basalis of Maynard's and other basal forebrain nuclei are not releasing that much acetylcholine onto cerebral cortex, maybe because you're just about to go to bed, then your cognitive abilities will be low. Okay, your cerebral cortex will not be functioning as well, and your cognition will not be as good. Okay, so in early Alzheimer's disease, what happens is these basal forebrain nuclei degenerate very badly, okay? Just like the hippocampus and the entorhinal cortex, they are particularly sensitive to Alzheimer's disease, and they are one of the first areas to go, okay? And this is believed to underlie the cognitive symptoms of Alzheimer's disease that occur early on. So basically, in Alzheimer's disease, initially, you feel just as though you're always about to go to bed, or, well, your cognitive ability is as though you're always about to go to bed. It's always in this sloppy sort of state, basically. Okay? Now, I want to stress that that is in the early stages of Alzheimer's disease. Later on, when the cerebral cortex has degenerated, then the cognitive deficits are no longer merely due to the lack of the cholinergic basal forebrain nuclei. Okay? But in the initial stages of the disease, the cognitive decline is believed to stem from the degeneration of the basal forebrain nuclei, which control how turned on your cortex is effectively, how functional it is, and how high your cognitive abilities are therefore running, basically. Okay, right. So those two little areas are particularly affected then by Alzheimer's disease, and they underlie the symptoms of the early disease. Later on, it unfortunately just spreads and all of the brain starts to degenerate, and that underlies the dementia of the later stages of Alzheimer's disease. Okay, right, so we'll call it there for this video, and in the next video what we will move on to is discussing the biochemistry of the neurodegenerative process. Okay, so we will discuss amyloid precursor protein and how it can be cleaved.